Welcome back to We Are Austin. At Dental Masters, it's about way more than fixing teeth. Dr. Jamie Laviola has been a trusted cosmetic dentistry expert for over a decade and delivers life-changing results. He's joining us this morning with what you need to know to maintain that happy and healthy smile. Good morning, doctor.
Good morning.
We've heard a lot about gum disease being a warning sign. What exactly is that a warning sign of?
So, gum disease can be divided into inflammation or bleeding gums, which we typically call gingivitis, or further down the line, it can be called periodontitis, which is when you lose bone or attachment to the teeth. But I think what you're asking me more is how does it relate to the overall body? So, there's been 57 diseases that have been identified that have an associative relationship with bleeding gums or inflammation. We don't have all the science on it yet, but there's definitely a correlation. If your gums are bleeding, there's inflammation, that there's a lot of different things that can be going wrong. And the first warning sign that we see typically.
So you kind of spoke to this, but if you can elaborate a little more. So does it predispose you to illness?
In some cases, yes. So we're seeing more data and literature about the cardiovascular health, diabetes. But there's other things where it doesn't predispose you, but it can make it worse if you have that disease or pathogen or whatever it may be. It will make it worse.
I'm very interested about this next topic, and that is stress and cortisol and how they play into dental health. We often hear that about overall health, but how does it come into dental health?
So overall, same thing, that stress is going to increase cortisol and other inflammatory markers. And when you have that going on, it can play a part in gum disease. It can also, as the other things we talked about, the other diseases, whether it be preterm birth, diabetes, cardiovascular, dementia is one that's new on the lectures. So stress all contributes to that, definitely. So finding out healthy outlets of how to get rid of stress, definitely a win-win.
What about right now? What are some of the trends that you are seeing in your dental practice with COVID restrictions coming back due to the Delta variant? How is that affecting what y'all do?
I haven't seen much in the practice with the Delta variant, but since people started to get vaccinated, we got more people coming back into the office. And because there was a year or so that people weren't coming in, a lot of dental issues, infections have gotten worse, and conditions have gotten worse. So treatment has gotten more invasive, more involved. Even worse, people that were sitting on things for a year before that, now that's 2 years, and so it gets worse and worse as you don't treat these things.
Yeah, that makes a lot of sense. Through COVID, healthcare as a whole utilized telehealth. Did you see that in your practice, and do you think it's something that can help dentistry overall?
I think it's a great starting point. So I initially was working on a virtual consult before COVID, so I kind of was lucky in that sense. And what it does is it helps me to get more information about the patient, what their fears may be, what their interests are, and from there, they're going to have to come into the office to get a diagnosis and a treatment plan. But it just helps to screen, and also to maybe lower the fear or the anxiety about coming in, and just make sure that you're a good fit patient and doctor.
And to that point, what do you see as common misconceptions that patients or your patients might have about dental health?
The number one misconception is if I don't feel anything, it doesn't hurt, or I don't see anything, that there's nothing wrong. And that couldn't be further from the truth. There's been times where we take three-dimensional x-ray scans where somebody had no symptoms, no signs. You couldn't even see it on a regular dental x-ray. And then we saw a huge cyst, and someone had to lose 3 teeth and needed bone grafting because of that. So these things are happening a lot. But yeah, that's the big one. If you don't feel it or see it, I don't need to do anything about it. And I think that's pretty general with the whole body. People kind of behave that way. What else? The other thing would be is if my insurance doesn't cover it, then I don't need it. And that's a little controversial topic, but my treatment plans and how I diagnose doesn't come from what the insurance tells us we can do. It's what's best for the patient, and then insurance helps to reimburse whatever it may be.
Everything you're saying is making a lot of sense, and I feel like it underscores the idea of being proactive about your health and taking initiative, making sure you're in a good place, and that whole body health being important. Where can people go for more information about you and your practice?
It's www.drlaviola.com.
Awesome. Thanks for your time today. We appreciate it. Have a good day.
Thank you.